Feels so good for you inviting me to come and share some thoughts with Ghanaian women. I've been a very busy gynecologist in the Washington, D.C. area for the past 30 years, and I'm originally from Ghana. Grew up in Osu, Ringwe Estates, and I have treated American women for various gynecologic problems over the years. And on my trips to Ghana, I realized there are some challenges that I've always wanted to address with the Ghanaian women. So I'm very glad that you've given me this opportunity to come and share some thoughts with my people.
Wonderful. Now, how conscious are Ghanaian women about their health?
Larry, you went straight to the meat of the problem. And coming here today, I heard even on the radio that on a questionnaire recently, 50% of the female population did not know about access to the medical facilities that were available to them. And awareness is the very beginning of taking action about your health. So without that awareness of the health condition and also how to access the health systems, it becomes a real problem.
Well, certainly. Okay, now let's begin to look at some of the problems, the challenges to women's health in Ghana.
You know, it is such an important topic when you talk about women's health. We all know very well, and it's very intuitive, that women's health is so important to the family structure, and so bears directly on a society as a whole, and it's in the fabric of development of any nation. This is very well recognized in so many different environments, because face it, women are the ones who plan meals at home. They're the ones who clean the household. They take care of the house, the health of the family. So if the woman's health is compromised, it affects the whole family and eventually the whole country. And because of that, the World Health Organization, for example, set something called the Millennium Development Goals. There were 8 specific points, and about 5 to 6 of these were directly aimed at improving women's health. And there are definite challenges in the Ghanaian system which we are going to address today.
Right. My guest this morning is Dr. Francis Dickson of the Nova Surgery Center. He is an advanced laparoscopic surgeon, and that's in the consulting room this morning. Now, let's begin with the most common that we have in the country concerning challenges to women's health.
I'll talk about nutrition first, because as you know, you are what you eat. And so good nutrition is most important to any human being's health. And when you have a culture where it's been perpetuated that the best portions of meals in the house will be reserved for the males in the house, it becomes a challenge already to women whose health is already compromised. As when you look at a study that says that 65% of women that are actually pregnant are malnourished, and 45% of women as a whole are malnourished, you can see the challenge to women's health. It is very important that when a woman is pregnant, for example, they get certain nutritional benefits. And that's why in the developed world and some developing nations even provide what we call prenatal vitamins to supplement what the woman is already getting. Because the formative years of the baby's brain requires certain nutrients. So malnourishment affects women's health tremendously, and I see that as a very big challenge.
Malnourishment. So it means a woman must prepare for pregnancy.
Yes.
And in the preparation, diet is important.
Yes.
Step 1.
Yes, that's very important. And being healthy is not just a matter of eating food, eating nutritious foods to prepare the body for pregnancy. And being malnourished is not a matter of just eating food. For example, I'll take it from two aspects. Within the cities and the privileged areas of the society, you're now seeing people who are eating the wrong things, and obesity is, for example, becoming a problem. Now, what happens with obesity? Obesity can lead to even infertility because of poor ovulation and things like that. And then when you go to the rural areas, you have people who are not getting enough to eat, and that also poses a problem. That's why I think the nutrition, not just eating, but proper nutrition, awareness of the right things to eat to nourish the body in preparation for pregnancy, are very, very important issues for our women.
Now, Dr. Dickson, so what are some of the things that women ought to consciously eat? Because we see cases of women being given calcium tablets, folic acid, and so on. So what should women consciously try to eat to build their bodies to carry their pregnancy?
Yes, a lower carbohydrate diet is important. I think it's good to nourish the body, but too much starch, carbohydrate, is not very good. Essential vitamins. For example, if you take prenatal vitamins that have been provided for women, it requires iodine, and iodine you can actually get from eating seafood, for example. But there also you have to be careful, because our waters are sometimes polluted, and there is an alert out there for galamsey, for example, adding mercury to the oceans, and so you can have toxic consequences to the baby. So I would advise pregnant women to avoid eating fish that is not well sourced and could contain mercury and PCB, which is from the rubber and plastics in the environment. So I think a good diet will have a moderate amount of carbohydrate, will be rich in protein, and not too much oil. That would be good for our pregnant women.
Right, so you're listening out there. This one goes straight to you. Prepare your body for pregnancy. Diet here, and not any diet at all, but we ought to be, it ought to be knowledge-based. All this is coming from the Easy Consulting Room this morning from the lips of Dr. Francis Dickson. Doctor, step 2.
Yes. We then go straight to reproductive challenges in our female population. And with that, of course, we talk about infertility. Fertility is not something that is given. And in every society, you will have some women who will have challenges with infertility as a result of hormonal factors and just anatomic problems. But it is an open statement that infertility is a result of poverty. When you look at the infertility issues, which are very prevalent in our country, most of it is related to sexually transmitted diseases, for example, and conditions like endometriosis, and these are actually mostly preventable. So awareness about reproductive choices, sexual issues, and how to avoid certain situations, and also awareness of when you contact any of these issues, having access to the right environment, healthcare facilities for treatment becomes very, very important, so that the disease state does not linger and create infertility. Infertility is a big problem for a woman. A woman is completely devastated when they are not able to reproduce. It gives them esteem, and its psychological trauma and the consequences are very, very severe. And unfortunately, women, more so than men, bear the brunt of this problem. It's always a woman's fault in our environment.
Certainly.
And it is not so, actually, because 48% or so is usually a male factor type infertility, but we blame it all on the women. And the women do not know, or the family would not know about recent advances that could be used to help them be able to reproduce as well.
Okay. So could current lifestyle of a person, a woman, go on to cause infertility?
Absolutely, Larry. There is something to be said about discretion and sexuality, and because the studies clearly show that avoidable sexually transmitted diseases, number one, are primary to causing over 80% of the infertility cases, where we're specifically talking about gonorrhea, chlamydia infections that go untreated. When a woman contracts any of these sexually transmitted diseases for the very first time, it will decrease their fertility by 15%.
15%?
If that is even treated and they get it again, now you're talking about a fertility that is decreased by over 40%. So this is not to be taken lightly. And of course, awareness, use of condoms, and also just abstinence works. But where that is not possible, monogamy, just sticking to one partner, will make sure of preserving the woman's reproductive potential.
Monogamy, that means there must be agreement and trust between both the woman and her partner. Going multi-system could aggravate the situation.
Yes, it could. And I'm glad you hit on that, Larry, because there we're not talking about just the woman being devoted to one man. We're talking about the one man being devoted to the woman.
So it's about sexually transmitted diseases, and today, on top of people's mind, a lot things to do with infertility. From your studies and practice, do you see this problem rising currently, infertility amongst our women folk?
It is an absolutely huge problem, and the toll on the society is huge, because the biggest aspiration of any adult is to be able to someday reproduce. And when that is taken away from a couple, it becomes a very big source of frustration, can lead to families breaking up, and the women being almost dispossessed, because for a woman, having a child gives you some inheritance, social status, and this is a huge problem for our women.
Okay, currently we are looking at challenges to do with women's health in Ghana, not the ones for the men. When it comes to looking at infertility, we're looking at the women's side. That's not to say that the men don't also get affected. My guest this morning, well, I think I'm rather his guest because we are in the consulting, easy consulting room. It's Dr. Francis Dickson of the Nova Surgery Center. He is an advanced laparoscopic surgeon. So this is the easy consulting room. So we've seen, so that's about, now two quick things about blocked tubes, as we hear about, and also fibroids. Are these also due to STDs on that?
No, the blood fallopian tubes, as you said, is the number one cause, because here we are talking about sexually transmitted diseases and conditions like endometriosis. These can lead to damage of the fallopian tubes in the female. And that is why some of these things, 50% of the time, can be corrected if the woman has the awareness to seek help from the right sources in the healthcare system.
Right, okay.
And also, fibroid tumors are different. Fibroid tumors, we don't think are so much hereditary, even though there's some hereditary component to it. But that's where what we talked about earlier, the diet that is very rich in carbohydrates and starch will make the fibroid tumors bigger, and once they start developing, and make it difficult for some women to either get pregnant, or when they get pregnant to have miscarriages. So it goes back to what with our number one topic, which was the nutrition and diet that is too rich in carbohydrates. When we talk about carbohydrates, we're talking about things like yam. Of course, I love my pona and my yellow yam, but it's rich in estrogen. And the estrogen, too much of that will fuel the growth of fibroid tumors to where they become so big that they affect the woman's reproductive potential.
Right, so we know two things now. We know about STDs, we also know about poor diet and how it's affecting. The topic we are looking at is challenges to women's health. What's next, doctor?
I will talk about the access to health itself. And by access, I don't mean that the physical buildings for healthcare are not available. The physical building can be there, but the woman needs to be educated enough to know that the condition they're experiencing is abnormal and that something can be done about it. That's number one. Number two is that physical building has to be available in communities close by where the woman can access it freely. And when she gets there, there's some monetary exchange that needs to take place. And that's where government may step in, for example, especially in our rural areas, to be able to assist them in obtaining the help they need if they cannot afford it. Now, that being done, that's number two. Number three will be to have healthcare personnel and equipment in these facilities to help take care of the woman's condition. Medication should be available for the treatment of the condition. And then we should be able to measure outcomes for these women to make sure that their healthcare issues have been properly addressed.
Right. So the healthcare facility ought to be there, well equipped. Also the knowledge of the women knowing that what I'm experiencing is abnormal and I need help. Great. Now what should be the next thing here?
We also know that women, by their nature, being the ones who nurture the household, are also exposed to certain conditions. For example, if a person unfortunately develops any contagious disease, HIV, AIDS, for example, who takes care of such a family member or a relation, especially in our extended family system? It is a woman. So the female, if God forbid, Ghana, we were lucky, and I always say God is a Ghanaian, did not suffer Ebola. But if we had, it would be the woman in the house to take care of such a sick person. And so by their nature, they are exposed to the sniffles and the coughs and the colds of the children in the house, and they cannot run away from that and say, oh, I'm busy, I have to go to work. They are exposed to diseases and they need to be supported.
Right. Okay. So in this case, how do we work our way around that? It looks like women are naturally predisposed to providing such care. So we have more female nurses than male nurses.
Absolutely. And so that's where the access to the healthcare system comes in. If they are able to take such patients and such family members to healthcare facilities where proper care can be given, or if they are compensated and assisted to on how to take care of such family members with proper attire, gloving, and the knowledge on how to take care of such sick and contagious, potentially, family members, it goes to help them greatly.
This is the Easy Consulting Room with Dr. Francis Dickson of the Nova Surgery Center. Yes, we're learning quite a lot. I want to hear some more.
My next will be the low acceptance of contraceptive use. And that has to do with, for example, if a grown-up woman married were to make the good decision of using contraception, There is the notion in some parts of our society that the woman is probably fooling around behind the husband's back, and that's why she does not want to get pregnant.
Right.
So contraception and its being affordable, accessible for a couple to be able to actually plan their family and how many children they want to have, how they want to space out the childbirth, and all that becomes very, very important.
So here it's more of teamwork. Men should be involved.
Yes.
Inside planning.
Absolutely.
And the knowledge, the understanding ought to be there. Great. Because women, they bear our next generation as all right. We'd like to take the next point, Doctor.
Yes. And I would like to also address the issue of health itself and the access to potable water.
Access to potable water.
Yes.
Right.
Not only does it make it difficult for sanitation and the cleaning of households and making sure that there's a healthy environment in the system, but also it frustrates the healthcare system. Any medical facility that you set up, especially in our rural areas, that does not have access to clean potable water is doomed to failure. And so a lot needs to be done to improve access to potable water.
Right, okay. So here we're saying a lot needs to be done to improve access to potable water. You're on Easy FM 107.5. This is the Easy Consulting Room. We'll take a short musical break and Doctor will tell us some more. The topic that we're looking at is challenges to with women's health in Ghana. That's the topic we're looking at. Don't forget, we'll also be opening the phone lines and you'll speak directly to the doctor. Ask the question you want to ask and you get the right answer. Michael Smith says the Easy Consulting Room with Dr. as he joins us every morning. That's Dr. Francis Dickson, who is the CEO of the Nova Surgery Center. He is an advanced laparoscopic surgeon, and we're delighted to have him here in the Easy Consulting Room. The topic we are looking at is the challenges with women's health in Ghana. A number of issues have been touched upon, and Doctor is going to tell us some more. The latest we looked at had to do with access to potable water. Yes, Doctor, I want to know some more.
Yes, that I'm so glad to be here with you on Easy FM 107.5 in the consulting room, and have access to your numerous listeners. I wish they could see your nice plush environment, and it doesn't do it justice to just be hearing about you. But let's talk about potable water, which we just mentioned. Of course, that mostly has to be provided by government. So we realize right there how economic environment, good decisions by the government affects health care systems. And I'm always reminded that some of the very best health care for women in the world is provided in Cuba, for example, where every pregnant woman becomes a ward of the state, where the government makes sure that the woman gets proper nutrition, because they are investing in the child that is going to be born. And when they go to the Olympic Games and they're winning the heavyweight boxing bouts, it's not because they are inherently stronger than the rest of the world, but because right from before the woman even became pregnant, somebody has invested in their health and taking care of their health throughout the pregnancy to be able to have a very healthy child. I'm also going to give you another extreme example, a country like Turkey, where I went a year ago to do some breast cancer awareness programs. I was completely amazed that they could actually put something they call a KATEM, K-A-T-E-M, and that is just a women's health clinic in several places throughout even the rural areas. These KATEMs, let me tell you, are manned by doctors, nurses, any woman can go to a CATEM as many times as they want to go and get themselves checked if they have any concerns about their reproductive or sexual health.
Right.
They can get mammograms over there. They can seek advice, contraception, and everything they need. That is an investment by the government that is fully funded.
Right.
So there are governments out there working very hard and investing in the greatest asset, which is the human resource. And where does it go? To women's health care.
Dr. Agre, blessed memory, was advocating investment in women's education, but these two countries, and maybe others who we don't know about it, are investing in women's health for the well-being of the country, of their nations. Good point there. We'll take another point from you, Doctor.
That is right segue into my next point, Larry. Education is so important. You know that the Millennium Development Goals that I mentioned earlier, the number one item was about exactly that.
Right.
Universal primary education for both men and women. Ghana, though, has done pretty well. We've made some strides with introduction of our NHIS and through the IEC, for example, where we produce brochures in different languages to help bring awareness to our women. But universal education is very important.
Yeah.
My own adopted country, United States, I'm a dual citizenship, don't worry about that, has done very well to unleash the potential of 50% of their population. Any country that blindly advances just the education of the male population is keeping down 50% of your population. Just imagine what equality of education for the men and women and access to jobs, equal pay will do for your entire 100% of your population. Now, when these women become empowered and get the proper education, they are able to make better choices and they're able to contribute very well and fully to the family. It gives them self-confidence as well. So education is very important. Now, once they are educated, then they are also able to rise in the society so that you don't have a situation where, how many districts do we have? Over 200?
That's right.
And you have about 25, 30 or so people representing the women in your parliament? No. You will get a better balance because empowered women in government are going to make decisions that are important for women's agenda, for women's programs.
Okay. So now, when it comes to the consulting room, the educated woman ostensibly will be able to describe her ailment better than the uneducated woman. Is that right?
It is absolutely important. When a woman goes to the doctor's office, and the doctor is going to do what we call take a history from the patient. And believe me, 70% of the doctor's diagnosis comes from the story of the woman herself. If the woman knows enough anatomy, knows her body well enough to be able to describe it, it makes the doctor's job so much easier. Even in the United States, sometimes I will sit there and I will have a patient come to me, white or black, doesn't make any difference, but when they are not properly educated, they will come to me and sit in front of me and tell me something like, if they are Ghanaian, Doctor, or I just don't feel well. You ask them to go a little bit further. It's up to you to tell me because I'm just here to tell you I don't feel well. But the educated person will be able to tell you exactly which part of the body is hurting or aching, and they watch enough programs to be able to describe the symptoms of the disease to you. So it makes the diagnosis a lot easier so that you can give them care.
Right. You're on Easy FM 107.5. This is the Easy Consulting Room this morning. And very soon we'll be opening the phone lines. But meanwhile, you can send your questions via text and WhatsApp your message to this number 0543928862. I could see many of you twitching your fingers already, and you want the lines to be open, but you can go ahead. Let's use technology now. Now many of our women, well, I know your first love seems to be the mobile device in your palm. So straight away 0543928862. Text or WhatsApp whatever question you want to ask straight away to us 0543928862. You have a question you want to ask Dr. Dickson this morning before we open the phone lines. Go ahead, send them before you forget them. I will be opening the phone lines also as soon as we can. This is the Easy Consulting Room with Dr. Dickson. We're looking at the challenges to do with women's health in Ghana. Education, we shortchange ourselves if we don't give priority or we don't give importance to women's education. What next, Doctor?
Yes, the education is so important. I'm glad we had time to talk about that. But now let's look at the system itself again. And after the woman has been good enough to know that something is wrong with her body and have gone to the medical facility, we mentioned earlier just a little bit about the prevailing condition and environment in our clinics and our hospitals. We talked about infertility, and I mentioned that sexually transmitted diseases are important.
Yes.
But if we know, for example, that maternal mortality is high, sometimes it's the environment that the woman delivers in that creates the problem. If you have a very healthy environment with the ability to control any postpartum bleeding, which is one of the main causes of the maternal mortality, then you are able to control this condition, which has gone without any change in the significant change in the incidence over the last 20 years. Maternal mortality is very important. Actually, about 24% of death among the reproductive age group in women in Ghana is due to childbirth-related problems, and that is completely unacceptable. When over 180 women out of 100,000 that give birth die, that can be controlled if you have supervised childbirth prevailing, because even though we are not, NHIS had made it possible for these women now to mostly, even in the rural areas, get some kind of prenatal care.
Yes.
The actual delivery is not supervised in most cases, and that is a problem. We need to train more people and have more controlled deliveries in sanitary conditions to make sure that the delivery, a woman does not go in to have a baby and then has a live baby but loses her life.
Right, okay. Okay, so it's all about women's health, but I want to know what is next.
Yeah. It is also very important that, for example, abortions, when they are performed in unsanitary environments, can lead to infertility. And we mentioned earlier about sexually transmitted diseases. Well, that is the cause, the woman's choices that she made to get the chlamydia and gonorrhea. But if a woman gets an abortion, which it's well recognized that over 90% of abortions are in unsterile environments, that becomes a problem, because that leads to infertility issues because of infection that follows such unsanitary abortion processes. And so a woman then develops either complications from that infections that lead to scar tissue in the womb, blockage of the fallopian tubes, and can lead to them becoming either infertile or having menstrual problems, or even if they are able to conceive, having premature labor and loss of their babies.
All right.
So that is a very important, that is one that is caused by the health care environment itself, creating a condition and a problem for the woman down the road.
Healthcare environment itself. Wonderful. The next one again, Doctor.
Yes, we will be looking at this point we've already mentioned the maternal mortality and the infertility issues. Now, there are developments going on that women should be aware of. For example, we talked about fibroids, endometriosis. There are new technologies for managing these conditions. And when these are not options, are not known by our women, and the healthcare system does not offer these management options, then it becomes a problem for our patients. One thing that I have been struck by is this condition called endometriosis, for example. It starts very early in a woman's adolescent life, whereas they have menstrual cycles, they will notice that they have an unusual amount of pain and related to that. Most of the time they will report to the mother, of course, and when they are given some paracetamol and a few things and it doesn't work, it's reported to some medical officer. But it's mostly ignored and can lead to very serious consequences, because endometriosis is a condition that causes infertility as well. And whereas in the United States, I only saw one case of very severe and advanced condition where this endometriosis can actually get into the lungs of the female, travel from the pelvic region into the lungs to the point where the woman will cough up blood every time she has a menstrual period. I have seen 10 cases in Ghana in 2 years. And that's because these conditions are not picked up early enough, treated with the urgency that they need to be treated with, and also the approach to the management of these conditions are not available or are need to improve for our women.
Improve. This is the easy consulting. Doctor, I have a question for you. I just got one message coming. He says, I am a woman married for 6 years and no child. I did my first HSG in the year 2012, which was good, but the current one I did, that was last month. My report indicates that my right tubes are blocked and there's no spillage. My doctor says my means of getting pregnant isn't going to be easy. What's your take on that?
You call with a very, very important question, and that is dear to my heart. That's what I specialize in. Because you are fortunate that at this point, one tube is blocked, and this is where the condition can be remedied. Because you are like most women who have infertility because of a tubal factor. And we need to get to the basis of what caused the one tube to be blocked, and to preserve the other tube and save it from becoming blocked. You need to see a doctor to take a proper history from you as to how this condition developed, because you were not born like that. And there's a simple technique called laparoscopy that can be performed to look into the abdomen and look at what is causing your tubes to gradually, both of them eventually becoming blocked. This can be salvaged. Studies show that 50% of the time this situation can be reversed with a simple procedure. Hysteroscopy will look into your womb and see if there's any scar tissue there. Laparoscopy will look inside your abdomen to see if you have any scar tissue wrapped around your fallopian tubes that is blocking the fallopian tubes. So it's not enough just to do a hysterosalpingogram, that's the HSG that you had done, but something can be done about it, which is removing the scar tissue that is making it difficult for you to conceive. And this is a very simple procedure that should be available.
Right, you sent that message, and that's your answer from Dr. Dickson, who is an advanced laparoscopic surgeon He is also the CEO of Nova Surgery Center. So that means you've come to the right consulting room. Advise yourself on that. You too can send your question by text or WhatsApp to this number 0543 928862. That is 0543 928862. By text or WhatsApp. I have another question that's come up. It's the same, and it says, I'm a woman married for 6 years. You know that she says she is 32 years currently, and she feels pain in the right tube.
That is a very, very good question. I get this all the time. And as a doctor calling me in my consulting room here at Easy FM, I would ask, I would have liked to know whether this pain is constant, whether it comes and goes, when is it worst, is it mostly around the time of your period? Now, remember we talked earlier about knowing your body.
Yes.
Yeah, you are telling me that the pain is in the right tube. But on that right side, you also have your ovaries. So it's very difficult to know that this pain is actually coming from your fallopian tube. Unless some doctor has done an ultrasound, for example, and told you that that is where the pain is. It could be your ovary. It could also be this condition that I spoke about, endometriosis, could be causing this pain that is on your side, especially if the pain happens to be accentuated or much worse around the time of your period. By that I mean like a couple of days before your period or during the period, the pain seems to get worse. Even fibroid tumors, depending on where they're growing and extending to, can cause pain on one side or the other. I don't think you have appendicitis, because God is good, but appendicitis, you cannot sleep on it, you'll be dead by now. So I really think that you need to consult with a physician, and please don't ignore it. If it's mostly around the time of your period, then you are onto something. It's related to your reproductive organs, but it could be just your ovary, it could be a fibroid, it could be scar tissue, it could be endometriosis.
Well, right, so you're in the right place, but you're far away from us. So advise yourself, because this is the Easy Consulting Room. Dr. Dickson is an advanced laparoscopic surgeon, CEO of Nova Surgery Center. 9 o'clock, I'll be opening the phone lines. We'll hear your voice as well. But meanwhile, the text and WhatsApp number is still available for your question, 0543-928862. The topic we're looking at is challenges to women's health in Ghana. Dr. Dickson, you have some more on there. We want to get everything from you today.
Yes, I would like to also emphasize the empowerment of our women. We should not ignore the women's health groups that are doing a lot of work in this country to bring the awareness programs to the female population. That is very good and needs to be encouraged. I think when it comes to choices that women need to make, it all centers around awareness. And I would like to, at this point, talk about the leading causes of death. And breast cancer, for example, is very, very prevalent in our society and rising, as a matter of fact. I think awareness of it and monthly self-breast examinations by women is also very, very important, because you are the one that lives with your breasts every day. And so just giving yourself 5 minutes of your time every month, at least 5 days after your period has gone off, standing in front of a mirror, looking at your breasts, looking for changes, visual changes, and then using your fingers in the right way to actually feel the breast for any unusual lumps, will help you diagnose breast cancer earlier. Studies show, without a doubt, that it's a curable disease if it's found earlier. And if these lumps are removed, and we actually have places in the country for then treating you with either radiation or chemotherapy to save your life. And in the developed world, women are surviving this disease. But we have late access to the healthcare system because the women don't examine themselves enough to pick these diseases up early enough.
Right, so that one is about breast cancer. We'll extend the time. We were originally scheduled to close the consulting room at 9 o'clock. We're going to extend it because there's still a lot more to take in. This part has got to do with breast cancer, early detection, there's treatment. Yes, doctor, do you have anything else?
Yes, there's a lot more. I've been doing this for 30 years, and you know, it's a privileged job.
Okay.
I spend my whole day talking to women and treating their healthcare issues. So I know a lot of issues they come up with over the years. Let's go on to cervical cancer, which is the #2 cause of cancer death in our women. Why is it so prevalent in our society? Again, it comes back to the lack of awareness. I think we now know without doubt that cervical cancer is a sexually transmitted disease.
Cervical cancer is?
It is a sexually transmitted disease, 100%. It's a virus called the human papilloma virus. This virus is transmitted to the female through sexual intercourse. So, again, it starts from the man. So much so that in the developed world, now we immunize both men and women against acquiring this virus, starting at the age 14. It can start as early as 9 years of age, part of the routine immunization of our younger people, and we can stamp out this disease. We have not even gotten close to implementing vaccination against this huge burden in our country.
Who is immunized, the man or the woman?
Both.
Both of them.
Both of them are getting immunized.
We're listening.
In the United States, I advise all the parents who come in to see me to get their kids immunized, both men and women. It's been going on for at least 5 years. But we are still at the stage of trying to pick up cervical cancer in this day and age. And the lack of awareness of the symptoms of this disease, cervical cancer, leads to very late diagnosis and death amongst our women. There should be, even if we didn't know much about it, there are screening programs that can help pick up this disease in its early stages, where we have dysplasia or early cancer cells on the cervix, at the point where treatment is available and women can be cured of even pre-cancer conditions or cervical cancer itself. But this knowledge is not readily available. So when it comes to cervical cancer, let me summarize. Yes. It is a sexually transmitted disease. So everything we spoke about earlier, the use of condoms, abstinence and all that, will prevent the woman from acquiring this human papilloma virus, which then leads to precancer cells. And even if they were available, the women made themselves available to get what we call pap smears.
Pap smear, yes.
The pap smear will pick up these early signs of cervical cancer, and the disease could be stopped in its tracks. And even if the woman went on to develop cervical cancer, if the woman knew the early signs, like spotting and bleeding in between your periods, a foul discharge from the vagina, vaginal odor, all these things will